Hello again. I hope you're coming back for the second, third, or 50th time. I'm Dr. Jim, and as always, I have a great topic. Wrote an article. You could read it, print it, download it, share it, email it, or you could just watch me now, okay? My topic today, aggressive behaviors in senior care and how to effectively respond. Now, I've been in senior care for 31 or 32 years, maybe even a little longer than that. Started really young. Started really, really young. I knew what I wanted to do. Thank you, Mom in heaven, for leading the way. I always knew that I wanted to be in senior care. Didn't know in what way, fashion, position, or anything else. But I stumbled and I bumbled and I read and I studied and I observed, and here I am 3 decades plus later. And one of the things that I train on it live in person, on Collins Learning, on CEU Academy, at my blog, drjimcollins.com. I write a lot about this topic because it's near and dear to my heart. Aggressive behaviors in senior care. No, there's no senior out there that wakes up and says they're living in a nursing home and assisted living or whatnot. Hey, I'm going to be a real train wreck today. I am going to cause so much havoc and hell. I'm going to get up and just wreck the joint. At least I don't know too many seniors who do that. But they are dealing with a multitude of physical conditions. Look, either they're in their 60s and 70s and they didn't live right, they had poor lifestyles, or they worked in unfavorable conditions and now their body's a train wreck physically. Or they have mental and emotional, psychological, psychiatric issues. They have Alzheimer's or Parkinson's or Huntington's. They have horrible rheumatoid arthritis. They have all of these conditions that put them in pain and discomfort, and they're living in aggregate living with other residents who are similar under one roof, and someone's bound to get aggressive, right? I wrote this very detailed article. Feel free to read it, respond to it. Man, I went deep. I wrote 4 pages on this particular topic, and boom, I just went because I love this topic so much. But I want to talk about this. What causes aggression? What should you be looking for? Look, if you're a caregiver at home, God bless you. My wife, wonderful wife Annabelle, our little daughter Karina, even though she was too little at the time to know, we were taking care of Grandma, my mother, Mary, and for 16 years. And at first, she didn't really have that many problems. She was a very hardworking, sturdy, robust, 100% Italian woman. And hell on wheels. But she started to decline. Memory starts going, leaving the stove on starts to happen, burning pots and pans, and falling and falling and falling. We finally came to the point where, well, I did in my heart. I'm a gerontologist, but I'm a son. And I said, Mom, it's probably time for assisted living because I just don't feel, I'm working 10 hours a day. Annabelle's working all these hours. You're setting things on fire, and Karina's 3 years old. So we had to make a really hard choice. But, during her periods of, anger, frustration, aggression, and then when she moved into the assisted living, I saw things like what I'm going to talk about. And then eventually she had to go into skilled nursing, and then after skilled nursing, memory care, and that's where she died. But what causes aggression? You and I have got to get our hands around this. If you are a caregiver at home, I hope something resonates here with you. If you're a professional caregiver in senior care, I also hope something resonates with you. Number 1, the biggest cause of agitation, aggression, irritability, frustration, you name it, is the deterioration of nerve cells in the brain, leading to an inability of that person to communicate. That's it. Can't put the words together. I can't find the words. This damn disease is impairing my grammar. I can't find the right words. I could look at this all day long and not find the name of the object. I could say I need my glasses and they're not these glasses, it's this glass. Inability to communicate. So what do we need to do? Help them find the words. We have to be patient, we have to be kind, we have to be empathetic. It's not them. It's their brain being deteriorated. 2, underlying medical conditions. A UTI, an infection, a cardiovascular problem, diabetes, low sugar, high blood pressure. Any physical condition can exacerbate the symptoms of Alzheimer's disease, including aggression and frustration and combativeness and physical attacks and yelling and screaming and everything else. Again, it's not them. Nobody wants to do that. That's what I believe. I believe nobody wants to attack somebody else at their age. They're 90. Why would they want to attack you? 3rd, they have underlying emotional or psychological issues. And I'm going to tell you what the biggies are. Yes, their anxiety. Yeah. Their depression. You know what else they are? Helplessness. I'm old. I live in a room. I have 4 walls. I have a roommate. Or I don't have a roommate. I'm alone in a private room. Kind of do the same thing day in and day out. Is it Monday? Is it Wednesday? Is it Saturday? What the hell day is it? Does it matter? I'm hopeless. I'm lonely. I don't have much meaning or purpose anymore. You mix those in and you get a perfect storm of anger and aggression. 4th, social and relationship problems. The old individual, the older adult that you're taking care of, they don't get along with their roommate. This is fun. This is a classic. They don't get along with their roommate. They don't get along with the residents sitting at the breakfast table, the lunch table, the dinner table. They don't get along with a particular nursing assistant. They just don't like that nursing assistant or that nurse or the administrator or the social worker or the activity professional, whomever. And they don't get along with their family members. There are a lot of problems. So we're talking about some relationship dynamics that are also causing that perfect storm to rise. Number 5, the physical environment and organizational issues. Do you have enough staff? How's the environment? Is it happy and bright and warm and cheerful? Or is it institutional? Am I a senior living in one of your buildings and I feel like I'm living in a glorified hospital? Not cool, not good. Where's my quality of life? Okay, so how do we respond? We have to start. How can we make things better? We have to start baseline, always. Baseline assessment, behavioral assessment, psychiatric evaluation. When I was a younger professional, I owned and operated a geropsychiatric firm. And I worked with 7 great psychiatrists, a couple geropsychiatrists, a team of therapists, and we went into just about every single nursing home in Northeast Ohio. And I got a 7 to 8 year education on geropsychiatry that is priceless, and I still remember just about everything from it. You got to start with an eval. You got to start with an assessment. You got to get a baseline. Number 2, you have to put a very good plan of care together that have effective, realistic, memorable interventions. You could say, oh, intervention number 1, number 2, number 3, number 4. And when I go out to the floor and I ask your nursing staff or I ask your nursing assistants, what are the interventions you guys should be doing that are written in the plan of care? Yeah, I'm not going to answer that question. That's a question for you, okay? Number 3, continuing education and training for your staff. They can't do the right thing unless they know what the right thing is. Number 1, they have to have a good heart. Heart, mind, soul has got to be in it. Okay? Genuine caregivers. Crystal clear, communicating, empathetic, loving caregivers. But then give them the tools, give them the techniques, give them the methods how to approach. What type of tone should I use in my voice? How long should I maintain eye contact? If they're in a wheelchair, should I get down to their level? If they're aggressive, should I stay an arm's length or a leg's length away from them, so on and so forth. You have to train. 4, this is something you can't train on, compassion and empathy. Those are extremely important things. Okay, so I could go on and on and on, but I want to give you the bottom line and my final thoughts. Prevention is the best medicine. Having a person-centered community environment, a wonderful, loving atmosphere in senior care goes a long, long way. Having a well-trained, prepared, who was it, Napoleon, as a leader and doing the job correctly, you have to be responsible for being prepared. You can never be unprepared. So you have to train. You have to educate. You have to look at underlying conditions. You have to be a detective in order to find out. You can't hit the bullseye unless you have a target. So take a look at these things. And please, there's so much more information in my article. Share it, print it, email it, and stay in touch with me, please. My email is jim@collinslearning.com. I'd love to hear from you. Check out my companies online, collinslearning.com. Phenomenal, robust online learning management system. CEU.academy for a lot of continuing education for just about every healthcare professional in America. So that's it. That's all I have. Thank you so much for your time and attention, and keep doing the right thing for your residents and for yourself. Thank you so much for taking some time to watch the video. I appreciate it. And if you're a licensed healthcare professional who's looking for some great continuing education, we've got it. And we are always working on brand new, fresh content for you. So you can find the link to the website in the description. And keep coming back for more information. I hope to see you soon.